What to do if your dog won't eat. Here's a more detailed explanation of what to do if your dog is not eating. Check for health issues. If your dog suddenly stops eating or shows a prolonged decrease in appetite, it could be a sign of an underlying health problem. Dental issues, such as gum disease or broken teeth, can make eating painful. Gastrointestinal problems, infections, or other medical conditions may also be affecting your dog's appetite. Look for any signs of discomfort, like excessive drooling, bad breath, vomiting, diarrhea, or changes in behavior, and take your dog to the veterinarian for a thorough examination. Evaluate the food. The type of food you're feeding your dog could be a reason for their reluctance to eat. Check the expiration date on the food bag to ensure it's still fresh and hasn't gone stale. Consider the flavor and texture of the food as well. Some dogs may prefer dry kibble, while others may like wet or raw food. Experiment with different brands or formulations to find what your dog enjoys. Avoid free feeding. Leaving food out all day can make your dog less interested in their meals. Dogs are more likely to eat when they have scheduled feeding times. Provide meals at consistent times each day, and if your dog doesn't eat within 15 to 20 minutes, remove the food until the next mealtime. This helps create a routine and encourages your dog to eat when food is available. Minimize treats and table scraps. If your dog is getting a lot of treats or table scraps between meals, they might be filling up on those and not feeling hungry during their regular feeding times. Limit treats to a minimum and offer them as rewards for good behavior or during training sessions. Create a calm eating environment. Some dogs are sensitive to their surroundings and may not eat if there's a lot of noise or activity around them. Designate a quiet and peaceful area for your dog to eat, away from the hustle and bustle of the household. This can help reduce stress and distractions during mealtimes. Warm the food. Warming your dog's food slightly can release enticing aromas that may stimulate their appetite. However, avoid overheating the food as it may lead to the loss of essential nutrients or burn your dog's mouth. Try different feeding methods. Some dogs may enjoy hand feeding, especially if they are anxious or stressed. Additionally, interactive feeders or puzzle toys can make mealtime more engaging and mentally stimulating for your dog. Monitor water intake. Excessive water consumption before meals might reduce your dog's appetite. Ensure your dog has access to water throughout the day, but consider restricting water intake about 30 minutes before mealtime. Be patient. Dogs, like humans, can go through phases where they might not have much of an appetite. Changes in their environment, routines, or stress levels can all influence their eating habits. If your dog is otherwise healthy and doesn't show any concerning symptoms, continue to offer their regular food and monitor their behavior. Skipping a meal occasionally is generally not a cause for concern, but if the lack of appetite persists for more than a day or two, consult your veterinarian. Remember, any sudden or significant change in your dog's eating habits should be taken seriously. If your dog's lack of appetite is accompanied by other symptoms or persists for an extended period, it's essential to seek professional advice from a veterinarian to identify and address any potential health issues. Your vet can provide personalized recommendations based on your dog's specific needs and health condition.